Hi guys, I'm Trudy. Welcome back to my YouTube channel. Today I want to talk about some pros and cons of being an OT or an OTA. Also guys, please remember to subscribe to my channel and click the bell so you'll get notified every time I post a new video. I post a new video every Sunday. Now let's get into the video. Now one of the first cons I want to talk about with OT or OTA is schooling. There aren't a lot of schools for OT and OTA. So if you're applying to colleges, especially for public colleges, there's only a few public colleges, and it's not just like few state, like overall in all the states. That's why it is so competitive to get into OT or OTA school. So definitely one of the cons of wanting to pursue OT or OTA is schooling. There's really not that much schools. And another con that I want to talk about with OT and OTA, well, okay, it all depends. And this is the pay. In terms of pay, if you work for like the board of eds or like a hospital, yes, you will see your pay go up, gradually, like you'll get an increase maybe every year, or every often you get a pay increase. If you work, say, for the board of eds, I think they have like a scale where if you're entry level versus after 5 years, after 10 years. For the board of eds, you're usually tenured. If you work at a hospital also, you'll see your pay increase, however often they do increases. But a vast majority of the jobs are through agencies. And unfortunately, if you work through agencies, you won't see your pay increase that as much, because to be quite frank, you will have a new grad and an experienced therapist making the same amount. That's crazy, right? Meaning a new grad OTA and an experienced OTA a lot of times get offered the same pay rate through agency. And the same for OTR too. You'll have like a new grad OTR versus an experienced OTR getting pretty much the same pay. Another thing too with agency is a lot of times when you just start with the agency, even if you have a lot of experience, it's like they have this one flat rate that they offer like new therapists, whether you're a new grad or an experienced grad. So if you work for the board of eds, initially you might start off low, but your pay will gradually increase. Whereas if you started for the agency, your pay is going to be higher. But over the years, you're not going to see that much increase in pay. Well, that's definitely one of the cons of OT and OTA. Something else that I want to talk about is upward mobility. Well, if you work in a skilled nursing facility, the highest you're going to be is a rehab director. Now, I'm not saying like being a rehab director is not like upward mobility, but in terms of something in the facility generally, like an administrator, you usually don't see OTs, get considered for those positions. So yes, as an OT, you can work as a rehab director, but that's about it. As an OTA, unless you go back to school and get your master's, you're just going to be an OTA forever. No, I'm not saying there's anything wrong with being an OTA, but I'm just saying in terms of upward mobility, there's really not much further to go as an OTA. Whereas as an OT, you can be a rehab director, but in terms of like a higher position in the facility, there's not really much room for like a higher position in respective facilities. And even if you work, let's say, in the school system, the most you're just going to be like a senior therapist. And in terms of job, so this is a pro for being an OT or OTA. Honestly, there are a lot of jobs. It might not be in the setting that you want to work, but when you graduate, you more than likely will get a job. And if, let's say, at your school, they did one of these things where they had like different companies or agencies come in, even before you pass your boards, they'll be offering you jobs. So this is one of the great things about being an OT or OTA. There are lots of job opportunities. It might not be in the setting that you want to work, but you will still get a job. Another advantage of working in rehab is flexibility. Now, let's say you don't want to work full time. The best thing to do is get a job through an agency where you can take, part-time positions. You can be like a per diem therapist, where let's say you work 5 days a week for 5 hours, that kind of flexibility. Also, another flexibility is the settings. There are so much different settings for OT and OTA. There's mental health, There's hospital settings, there's school settings, there's home care. You can work with kids, you can work with adults, you can work with, special needs kids, you can work with the geriatric population. There are so much different settings and populations you can work with as an OT or OTA. So when it comes to pursuing OT, there are a lot of things you have to consider. I hope this video will help you if you're undecided about being an OT or OTA. Help you, kind of get an understanding of settings you want to work in, what are the advantages, is it worth it? Now, personally, I love being a therapist. I love the flexibility, but it's not for everybody. So I hope if you're undecided, let's say you're probably thinking of going to OT school or nursing school or PT school, I hope this video will give you some clarity as to which to pursue. Okay guys, that's it for this video. Thanks so much for watching. Please remember to like, comment, and subscribe, and share this video with someone who you think it might help. Also remember to click the notification button so you get notified every time I post a new video. I post a new video every Sunday. Also drop in the comments some advantages or disadvantages that you might think of being a therapist if I didn't mention those. Hope this video was helpful. Thanks so much for watching, and I'll see you in the next one.